Overall skin health, I think the most important thing is getting a yearly skin exam and also wearing sunscreen, SPF 30 or higher. If they have not been doing that for facial skin year round and exposed skin during the summer months. It doesn't matter how much cloud cover there is still damage that can be done by the sun. So doing SPF 30 or higher every day on your face, regardless of the weather, regardless if you're going out, you still should have that coverage and protection. Yeah, I do recommend the annual exams, especially if they've had a family history of melanoma or any skin cancer. That's another reason to come in for checkups. I also want to see anything that's new or changing. Somebody notices something or a family member notices something. It's always important to get those areas checked, regardless of if you just had a skin check. If it might be something new, it needs to be checked right away. Patients who have a history of skin cancer need to have checks more frequently than annually. Some people, I say you should come in twice a year for skin checks if you have a history of skin cancer or other types of abnormalities. I'm looking for a lot of different things. There are different kinds of skin cancers. Melanoma, of course, is the most concerning one because of the possibility of spreading, but you also have to look for other types of skin cancers like basal cell cancer and squamous cell cancer. So they all have different features that I'm looking for when I'm examining the skin. Pigmented mole scheme that we use, and it's somewhat easy to remember, is we talk about the ABCDEs of melanoma and abnormal moles. So A stands for asymmetry, when if you cut a mole in half, one side doesn't look like the other. Border irregularity, where a mole doesn't have nice smooth borders. If they're notched or irregular, that's something else. Color, that's what the C stands for. That's where if you have more than one color in a mole, whether it be red, white, blue, or even different shades of brown, those are all things that make it more concerning. D stands for diameter, the size of the mole. If it's larger than 6 millimeters or a pencil tip eraser, then that is something else that we look for, and that can be more of a concern. And then E stands for evolving. So any mole that you've had for a long time and it's changed in some way, or if you have a brand new mole that you've never had before, those should also be checked. So those are things that we look for. We give patients information when they come in for their skin checks. And, I always say, if you're in doubt, please come in, because I'd rather have a look at it and then either give you reassurance or do whatever needs to be necessary for testing. During the full skin checks, we of course talk about moles too. And so this one's okay for right now, but if there's any changes, let us know. Yeah, I've had a number of patients who've come in for full body skin checks. Family doctor or their primary care doctor may have recommended it just as a general tool for getting their baseline. And I have found melanoma, sometimes on the back or the back of the legs, where they're just not anticipating those. They can't see those areas of the body. Been able to catch those at early stages as opposed to something that could be progressed and then also get much worse. So that has happened more than once. And so that's why I do recommend, even for patients who are coming in for other things, that they get annual skin check or whatever is recommended for them. With the full body skin exam, we do have the patient get undressed to their comfort level. They like to have underwear and bra on only. And then they put a gown on, and then I move the gown around as I'm checking all the different areas of the body. It's not as invasive as you would think. As I'm going through systematically checking all the spots, I'll mention if there is one that is of concern, what the concern is, and if there's any testing needed, then we can do a biopsy same day if needed, or additional testing depending on the spot. The testing is done at the lab, so that usually takes about 2 weeks to hear back, and they will always get a call from the office so that they get the results, whether it's a benign growth or anything more concerning. Just like breast exams, people are recommended to do that monthly. Same thing with doing spot checks on themselves monthly. So typically it would be after you get out of the shower, if you have a full length mirror where you can check as much as you possibly can, although it's impossible to really check your back really well. And then if there is anything new, found it at those monthly checkups to make an appointment. If there's a family history of skin cancer, especially in an immediate family member, then it should be whenever their pediatrician or family doctor recommends they come in to start, which could be right in early adulthood. And then for all my adults, I do recommend checks. Yeah, I have a lot of college students that come in for their skin checks annually. They have, family members who've had skin cancer. They've had friends that have skin cancer. So I don't think it's really ever too early to come in. The sun protection is always something that I harp on a lot, but it's wearing SPF 30 or higher on a daily basis on the face. I also recommend treating the back of the hands with sunscreen every day. People do a lot of driving. They don't realize how much their hands are in the sun. The sun comes through car windows. And then sun protection if you're going on vacation or you're going to be at beach or outside doing sporting events. Sunscreen is great. You can do the SPF 30, reapply every 2 hours, but also wide-brimmed hats and sun protective clothing. The long sleeve rash guard shirts and sun shirts for when you're outdoors is really important. The more sun exposure that you have, and most of us have it when we're children and then or in early adulthood, all that sun adds up in the skin, and then decades later you have a higher risk of skin cancer. So really important. And usually when people have a skin cancer, they say, okay, I'm not gonna go in the sun anymore. And that's good because then they're not increasing the amount of sun damage that they're getting, but it really should start at a younger age so that we can talk about preventative. That's a preventative thing you can do for your skin.